Hi, I'm Dr. Patrick Proffer. I'm a board-certified plastic surgeon in Amarillo, Texas. I'm a member of the American Society of Plastic Surgeons and the American Society of Aesthetic Plastic Surgery. And today, we're going to have a little bit of an interactive discussion about breast implants and breast augmentation to hopefully answer a lot of your questions and clarify a lot of the information that's out there.
So Dr. Proffer, someone considering a breast augmentation, what would the longevity of an implant be, or the general maintenance required post-surgical? Like post-procedure, what would they need to be thinking about?
Great. Well, that's a great question, probably one of the most common questions that we get. Aside from the general complication risks from any type of surgery, bleeding, infection, and scarring, I think there's some specific things you need to be thinking about with breast implants down the road. The first one is that implants are not permanent, and somewhere in the following years, there'll most likely be another procedure. It could be for a variety of reasons, all of which are relatively unusual, but collectively you have to consider that it most likely will happen. We used to conservatively tell people that about 10 years is reasonable to expect out of your implants. Our newer implants have behaved much better, so we'd expect longer than that. On the flip side, there's no routine maintenance, meaning that you don't need to have your implants changed every certain number of years. Commonly, it's been 10. So if you're doing well with your implants, you continue to go and get as long as you possibly can out of them. Okay. Number two has to do with breast cancer surveillance. So obviously, we care a lot about breast cancer and are very concerned about making sure that we're as safe with our patients as we possibly can be. With breast implants, you can have normal mammograms. I tend to put the implants underneath the muscle so that mammograms are easier to read. There's less obscured breast tissue. The important part is there's no connection between breast implants and breast cancer. And I really think that for a lot of people, when that implant is positioned under the breast tissue and pushes out, it makes your exams easier and a little bit more accurate, to the point that it can actually sometimes help you find little lumps or bumps that you couldn't feel before. A third thing to consider has to do with nipple sensation changes. A very common scenario after surgery is that the nipple actually gets more sensitive and then slowly tapers back to what it was before the time of surgery. But again, that can be critical for patients and something that's very important to ask about when you're in your consultation.